Okay, good morning. Well, it's afternoon now, so good afternoon, everyone, and welcome. Thank you all so much for being here. My name is Aran Moat, and I'm an outreach specialist working at the Maryland Department of Human Services within the Office of Constituent Experience. We're so excited to have you all here today. Myself, in collaboration with Jenny Garrison from Maryland Health Benefits Exchange, we're kind of brainstorming ways we could help Marylanders in light of just how tough and difficult this past year has been. And we thought, what better way to do that than creating a community webinar where we could come together to talk about some key support that is available to Marylanders. So today we'll have speakers from several state agencies and nonprofits who will talk to you about the support their organizations provide to Marylanders. We'll also share some links in the chat feature for you to be able to get more information about the services you need. And lastly, we will be emailing you the slides and a recording of today's webinar after the event, so you'll all have the information from today's event in your inbox soon. After we hear from each speaker, we'll also be hosting a Q&A at the end where the experts here will be able to call in and answer your questions live. But before we begin, I'd just like to go over a few housekeeping items. So all attendees today will be listed as listen only. So all of your microphones will be automatically muted and your cameras will be off except for those who are speaking. So all of our speakers today. All communication and questions must be typed and submitted through the chat, okay? Through the chat and the Q&A feature will be located at the bottom of your screen. So if you have a question, please type it in that chat so that we can get to you at the end of the program. Also, you will receive a copy of today's slide deck presentation. So don't feel like I missed something. I won't be able to see this information again. You'll all be receiving this information at the end of our program. So let's all get started. Today, our first speaker is Dr. Meg Sullivan from the Maryland Department of Health. So thank you very much and welcome, Dr. Sullivan.
First, thank you so much for having me, and good afternoon, everyone. I am incredibly excited to be talking to you about two incredibly important issues: immunizations and WIC resources. So we go to the next slide. I just want to first start off by stressing that vaccines remain one of the most powerful public health tools that we have to keep ourselves, our families, and our communities healthy and safe from disease. And as a pediatrician and a mom of five myself, I have firsthand seen the importance of childhood vaccination to prevent just really horrible diseases like RSV and measles. And as a physician and public health official during COVID, I also understand how essential our vaccine infrastructure is during emergencies and outbreaks. And so can really proudly say that the Maryland Department of Health is committed to broad vaccine access in our state, and we have taken the necessary steps to make sure you can access vaccines when you need them. We also understand that there may be confusion right now about vaccine guidance on the national level. And so we are well positioned and really committed here in Maryland at the Department of Health to respond and uphold science-based decision-making and make sure that there is clear guidance for our families and for our providers. So next slide. So in September, at the start of respiratory disease season, the Department of Health issued our own recommendations for kids, adults, and for those who are pregnant for the respiratory vaccines that include flu, COVID, and RSV. You can find those recommendations on our website, and they're also linked here on this slide. And importantly, these recommendations closely mirror the guidance and recommendations from major medical associations who have been making these recommendations for decades, like the American Academy of Pediatrics and the American College of Obstetrics and Gynecology. We also issued something that's called a standing order, which is essentially a prescription that allows any Maryland resident 6 months and older who wants a COVID vaccine to get one at your state, with your healthcare provider, at your local health department, at your pharmacy, or at other places throughout Maryland. In addition, we know that there has been some questions about other childhood vaccines, including the hepatitis B vaccine, which is a vaccine that is recommended for all newborns and then completing a series by 18 months. The data clearly shows that the hepatitis B vaccine is a safe, effective, and life-saving. And so therefore, we recently issued an advisory reiterating the importance of the full vaccination series for hepatitis B for all infants beginning at birth in accordance with the American Academy of Pediatrics recommendations. and also recently issued another standing order, or essentially again a prescription, to ensure hepatitis B vaccine access across Maryland. We also, on our website, have published what we are calling 2 FAQs, or frequently asked questions, for the public about both respiratory vaccines and about childhood immunization, really to make sure that we are providing clear evidence-based guidance and recommendations for our patients and for our families. And then just as a reminder, you can always talk with your healthcare provider or pharmacist with questions. And then just one more thing about vaccines to really ensure another important avenue for broad vaccine access in Marylanders. We recently launched the Maryland Vaccine Program for adult vaccine access, so that cost isn't a barrier for un- and underinsured adults. And this, again, on our website, and here you can find more information about what there's free vaccines that are available through counties, and or contact your local health department for more information. And then next slide. Just as one more example about getting information, we created the Maryland Combined Respiratory Illness Dashboard on our website, where the public can track things like hospitalizations and other activities related to respiratory illnesses, so you can make informed decisions to keep yourself safe. Then just to spend a couple of minutes talking about the Maryland WIC program, or Women, Infants, and Children program, which provides essential services, including nutrition education, breastfeeding support, access to healthy foods like fruits and vegetables, as well as health referrals for pregnant women, for postpartum women, for infants, and for children under 5 years. This program annually serves 180,000 Marylanders, helping to improve health outcomes for women and children. And if you go to the next slide, just as a little bit more information for women, WIC provides connection to prenatal care at early stages, improved nutrition during and after pregnancy, better management of weight gain during pregnancy, and a higher likelihood of carrying the baby to full term. And then for infants and children, again, as you see on the slide, really helps with improved diet and nutrition, enhanced growth and development, and reducing rates of some of the sickness that we see. In terms of who is eligible for WIC, Maryland residents with incomes up to 185% of the federal poverty level may be eligible if they are pregnant, postpartum up to 6 months after delivery or pregnancy, breastfeeding up to a year after delivery, or children under the age of 5. Also importantly, families within the eligibility or that may be eligible for WIC also may be eligible if they're participating in other assistance programs such as foster care, certain medical assistance, including certain Medicaid participation, the Supplemental Nutrition Assistance Program, or SNAP, or temporary cash assistance. Next slide. You can find out if you are eligible for WIC and apply for benefits using Maryland's one-stop benefits portal at marylandbenefits.gov, or contact your local health department. Next slide. Sorry, and this is the slide that shows, if you go to the next. Yeah. Where you can go. And then just a reminder to stay connected with the Maryland Health Department by following us on social media and visiting our website at health.maryland.gov. Thank you.
Thank you so much, Dr. Sullivan, for that crucial information. Now we're going to introduce Meredith Lawler from Maryland Department of Health Medicaid Program.
Hi, everyone. Thank you. My name is Meredith Lawler. I'm a special assistant in the Maryland Medicaid program. I'm just going to talk to you a little bit about our program in general. Next slide, please. So Medicaid is funded jointly by the federal government as well as the state government, and we provide healthcare coverage as well as long-term care coverage to low-income individuals, pregnant people, the elderly, as well as people living with disabilities. Next slide, please. So here in Maryland, you'll also hear Medicaid called the Medical Assistance Program, or the Maryland Medical Assistance Program. And one thing I really want to flag for everyone is that you can apply for Medicaid at any time during the year. So you don't have to wait for a certain period or a special enrollment period. You can always apply for Medicaid. Next slide, please. Medicaid covers a huge portion of our population here in Maryland. So over 40% of births are covered by Medicaid. Almost half of the children in our state are covered by Medicaid. Over 300,000 adults just to qualify under the Affordable Care Act coverage. And then over 80% of nursing home revenue is covered by Medicaid services right now. Next slide. So there's two different pathways that you can qualify for Medicaid coverage. One is called MAGI, or Modified Adjusted Gross Income, while the other is called non-MAGI, so non-Modified Adjusted Gross Income. For the MAGI population, income is used to determine somebody's eligibility. This typically applies to children, adults who are under the age of 65, parents or certain relatives, as well as pregnant people. For the non-MAGI population, individuals usually qualify as a result of being aged, blind, disabled, or enrolled in one of our home and community-based services programs, so some of our long-term services. They meet a definition of medically needy, or there's certain populations that income isn't a factor for. So foster care children, for instance, qualify for Medicaid just because they are a foster care child. Next slide, please. In Maryland, about 80% or 86% of our population is covered through a managed care organization in our managed care program. So a managed care organization oversees and manages the healthcare coverage for these individuals. You'll hear them called MCOs. And in Maryland, our program is called Health Choice. So you might also hear Maryland Medicaid referred to as Health Choice. And it just means the same exact thing. You'll just hear multiple names at different points. About 14% of our population receives services on a fee-for-service basis, so they're not enrolled in an MCO, but they have the same benefits as those who are in an MCO. Generally, that population is the individuals who are aged, blind, disabled, or enrolled in a home and community-based services program, as well as dual eligibles, which we'll talk about on the next couple slides. So next slide, please. Dually eligible individuals means that somebody can qualify for both Medicaid and Medicare at the same time. So they have both coverage at the same exact time, and both Medicaid and Medicare will pay for their healthcare services. Next slide, please. There's a few different ways that somebody can qualify as a dual eligible individual. So certain people who are disabled or over the age of 65 and receive SSI as well as Medicare, or have a certain income level, they can receive both Medicaid and Medicare. What happens in these instances is that Medicare premiums will be paid for by Medicaid, and Medicaid will wrap around to cover the Medicare service or the services that Medicare will not pay for. So, for example, if somebody goes to the doctor and there's some portion of people who, or some portion of the appointment that's not covered by Medicare, Medicaid will come in and take care of that portion of the appointment. Next slide, please. There's certain benefits that all states have to cover. So this includes inpatient and outpatient hospital services, nursing facility services, certain physician services, and a host of others. This list is non-exhaustive. In Maryland, we cover a whole host of additional benefits. So we have a very comprehensive Medicaid benefit here in Maryland. Next slide, please. We cover SUD services, for example, clinic services, dental coverage for adults in Maryland is covered. This specific slide is not exhaustive, it's not comprehensive, but these are just an example of some of the benefits that Maryland Medicaid covers. Next slide, please. The links that you see here are all different ways that you can find information or apply for Medicaid. So the first one is just our home. We have an eligibility page, but I want to draw your attention to this Is My Medicaid Going to Change page. As everyone knows, there's been a host of different changes as a result of federal legislation over the past few months. I want to flag that nothing is changing in Medicaid tomorrow, but it's really important that everyone keeps their information, their contact information up to date so we can contact you if something is changing to your coverage. This page, however, it's new. We're going to be updating it whenever we have new information to share with stakeholders, participants, providers, just about the changes that are going to occur in Medicaid. There will be materials that can be downloaded and printed and shared, so definitely keep an eye on that page. But if you have any questions, please don't hesitate to reach out. Thank you.
Thank you so much, Meredith. And moving right along, we now have Lyrica Welsh from the Department of Housing.
Good afternoon, everyone. I'm going to speak a little bit about an overview of some of our housing supportive services. We can move to the next slide that just kind of shows you a range of what I'll be reviewing, just some things about assistance with foreclosure prevention and our Office of Tenant and Landlords and some important numbers. And I'll have some things dropped in the chat so that you can always link back to this information. Next slide. If you are facing foreclosure or you just want some early preparation and assistance to avoid foreclosure, the department has a list of counseling agencies, and these are approved counseling agencies in Maryland. The link will appear in the chat, and it's also listed on our website, and that can help you achieve homeownership, avoid foreclosure, or even just improve your financial capability and prepare you for purchasing a home. Next slide. And some of the benefits of working with a housing counselor is one, that you can get mortgage assistance, support in the home buying process, avoid foreclosures and scams. And you can also learn how to reduce your debt and increase your credit score. They're all things available, and our housing counselors can assist you with that. Next slide. And also, there is a list of legal services if you are concerned about foreclosure or you want have some questions, you'd like to get some legal advice. There is a list of legal services, and that also will be provided and linked in the chat also with this presentation. And you can see the list of legal services that are located close to your area. And you can also use those legal services in support of mediation. If you are close to or thinking or in a foreclosure process, you have the right for mediation. And mediation occurs between a homeowner and a lender, along with the help of a neutral third party to help you facilitate dialogue and make sure that you have a fair argument as you're moving forward into foreclosure. Next slide. The Office of Tenant and Landlord Affairs is new to the Department of Housing and Community Development. We have a website that details all of the things that are offered through that division, and that also will be linked in the chat for more detailed information. The purpose is to ensure access to educational resources for tenants, and so that you know your legal rights and know what to do if you're violated of those rights and how to seek financial counseling. Next slide. The Tenant Bill of Rights is something new that all renters have to have attached to their lease. It's now law, and it summarizes the existing state and federal laws. It provides an overview of key areas of landlord and tenant law written, and it is accessible and a very easy to digest format. It must be attached to all residential leases in Maryland, and it is published in 18 languages and is also found on our site. Now, what the Tenant Bill of Rights does not do, does not create new laws or rights, and it doesn't cover every legal right tenants may have, and it doesn't include your local and state city requirements, nor does it replace consultation with legal counsel. Next slide. The first right of refusal just is a summary of this. Again, if you are living in the property owner wishes to sell, they must offer that right to the tenant first. And a lot of those details can also be found on our site. The landlord must provide the tenant with a notice that they intend to sell the property and offer the tenant an opportunity to meet their proposed sale price or match a third party or offer. The landlord must report to the state that they have offered the tenant 30 days to respond to their notice, and the landlord must refrain from listing or accepting a third-party offer until 30 days have passed or the tenant has responded to accept, decline, or counter the offer of purchase. Next slide. And again, here are some support and resources. Again, our website, which has been linked to the chat, and customer service line 1-800-638-7781, where you can call and be directed to the divisions and programs to the Department of Housing and Community Development, tenant support, home ownership, small business assistance. And if you are in need of rental assistance and you live in the areas listed here, please contact 410-901-4080. But in all other counties, we have a link to your local housing agencies that will handle rental assistance. Thank you.
Thank you so much, Lyrica, for all that important information. Now I would like to introduce my colleague, Marissa Timpson from the Department of Human Services.
Hello, everyone, and thank you all for being here. My name is Marissa Timpson. As Saran said, I am one of the outreach specialists for the Maryland Department of Human Services within the Office of Constituent Experience Unit. All right, Jenny, we can go to the next slide. All right, our unit is a branch of the Office of the Secretary for the Maryland Department of Human Services and has a unique support and service hub. We serve as the Department of Human Services Customer Service Center, offering clear information about our programs and helping those access the services that they need. Next slide. All right, I'd like to take a moment to just highlight some of the wide range of services that are offered by the Maryland Department of Human Services, here shown on the screen. So we have SNAP, energy, emergency, cash assistance, child support, and many more. All right, we can go to the next slide. All right, ways to apply. There are several ways to apply for our benefits. One way is online at our website, marylandbenefits.gov. Another way is at their local Department of Social Service office, or they can print out the application in mail or fax. Next slide. And we are also excited to share that we now have a one-stop shop application process. The Universal Benefits application can now be found on our website. Also on our website, as previously mentioned, we do have our paper applications that are accessible under the form. So if you go on the website, click under forms, you can type in 9701 or simply the FIA application. All right, so we are now going to get into a few of our benefits. SNAP is known for our Supplemental Nutrition Assistance Program. It is our widely known program, informally known as food stamps. Next slide. We also have the Office of Home Energy Programs, which provides energy assistance to help those with high utility bills. Next slide. Another important resource is the Emergency Assistance to Family with Children. This is a cash assistance program which funds those with children under the age of 21. So some emergencies may include domestic violence, some may include evictions, fire, flood, loss of major appliances, or a major theft. Right, so we do have two cash assistance programs. One is temporary cash assistance, which is TCA, and it helps the needy families with children. Applicants must also apply for child support and be compliant. Our second cash assistance program is TDAP, which is the Temporary Disability Assistance Program, and it helps those without dependents who have a disability. Next slide. Our Transportation Assistance Program, which is also TAP, it is eligible for TCA recipients. And we also have the website listed there as well. It is the www.vehiclesforchange.org to get a little bit more information. All right, next is our Child Support Administration. Child support plays a vital role in supporting Maryland families. This office handles a lot of cases that fall under the umbrella of other DHS services. So we work with custodial and non-custodial parents and guardians to make sure that the children have the financial support that they need to thrive. All right, our medical assistance program works with those who are over 65 and are Medicare eligible. So DHS works with those who are 65 eligible for Medicare, as well as those who are disabled by Social Security. And that includes children or adults that are also under the age of 65. DHS also provides the long-term care waivers, and we work closely with the Department of Health as a liaison guiding any medical assistance request to the right home. And here are a list of important documents to remember. These documents are highly requested with our case managers. Another few things to remember is that we have Maryland benefit review forms now, and we also have redeterminations. Redeterminations are due every 12 months. However, the Maryland benefit review form is sent out every 6 months. Okay, so here's our contact information. If you'd like more information or you need to get in touch with the Maryland Department of Human Services, there are several ways to connect with us based on what you need. We have our statewide call center. You can also visit our website, dhs.maryland.gov. You can also send us an email via the Contact Us page on our website. Please follow us on Facebook. We also have a Facebook page. And if you need to access any services or any benefits, please visit the marylandbenefits.gov or your local department office of social services. Thank you for everyone's time.
Thank you so much, Marissa. Now moving right along, we have Jenny Garrison from Maryland Health Benefits, Maryland Health Connection.
Thank you. My name's Jenny. I'm the Outreach Program Manager for Maryland Health Connection. And we are very excited to share that we're currently in open enrollment. So if you or anyone you know needs to access health insurance, now is the time that you can sign up. It stays open until January 15th. And as our colleague mentioned earlier, Medicaid enrollment is open year-round. It's also good to know that you can enroll outside of open enrollment if you have life events that cause a change in your circumstances. For example, if you lose your job and you lose your insurance through your job, you would have 60 days from that loss to then sign up for a health plan through Maryland Health Connection. And if you miss open enrollment, you can also check boxes on your state tax forms to indicate that you need some support with your health care. When you apply through marylandhealthconnection.gov, you put in information about your household size and your household income. And this is the household that you report on your taxes, not necessarily who you live with. And then once you put in your information, you would either be determined eligible for Medicaid or for a private health plan. All of our private health plans are licensed and approved by the state. We work closely with our colleagues from the Maryland Insurance Administration who are on the call for these plans. And we work with the major insurance companies in Maryland, CareFirst, Kaiser, United Healthcare, and WellPoint. So it's good to know that you can get a plan that is quality. And we do offer financial assistance through various types, advanced premium tax credits, and cost sharing reductions. And although the federal government hasn't extended some of the tax credits that help to lower costs at this time, Maryland leadership has stepped up with a state subsidy program that is going to help keep costs lower for folks in the Maryland Health Connection this year. All of our plans cover free preventive services, so some of the key immunizations that were discussed at the beginning of the call will be included. And all of the preventive care is free to help you find problems before they get worse and to live a longer, healthier life. There's a lot of details at marylandhealthconnection.gov about what's included. All plans come with the same essential health benefits or core benefits. And you can get more details about this at our website as well. And we also recommend looking at our value plans. They're designed to offer lower deductibles and useful coverage for more services before you meet your deductible. A good example is our value plan for diabetes management, which is going to cover more of the medications and tools you would need to manage your diabetes before you meet your deductible. We also offer standalone dental and vision plans with the 4 carriers you see on the screen. And if you're enrolled in Medicaid, your dental coverage is provided by Maryland Healthy Smiles Dental. Pediatric dental coverage for children is included in all of Maryland Health Connection's private plans as well. And we also offer vision plans. So if you don't have dental or vision coverage, but you do have health, you could still get a dental and vision plan separately at marylandhealthconnection.gov. And lastly, we like to let people know that telehealth services are also included in some of our plans. We know that health insurance is quite complex. We do have a system of team members that are available to support you. We work with about 2,000 insurance brokers in Maryland that are licensed through the Maryland Insurance Administration and authorized through the Maryland Health Connection. And they help you to look at the plans and the prices, and they help you to complete your enrollment. Similarly, our navigator team or consumer assistance team also provides free services to you to help you enroll. And lastly, we have a call center. So I'll add a few links to get help in chat in just a moment. And you can always visit our website at marylandhealthconnection.gov/events to sign up through our virtual events or see what in-person events our teams are hosting through open enrollment. And then lastly, you can also visit our website to sign up for text alerts or email notifications to get more information about healthcare. Thank you very much.
Thank you so much.
Sorry.
Go
One
right ahead.
last thing. Our colleagues from Maryland 211 weren't able to present today, but we wanted to recommend that if someone you know is struggling with paying for health insurance or other services, you can visit maryland211.org. Or you can call 211. It's a non-emergency phone number, and you can use this tool to search for what you might need. So you can see that if you're looking for sliding scale, free, or different types of insurance, you can take advantage of 211 as our resource hub in Maryland. Thank you.
Thank you so much, Jenny, and thank you for that extra information about Maryland 211. So moving right along, we have Ruth Getachew from Maryland Insurance Administration.
Great, thank you for that. Hi, everyone. My name is Ruth. I am the Director for Consumer Health Coverage Assistance with the Maryland Insurance Administration. I'm going to talk a little bit today about our agency and some specific resources that are available to consumers that are looking for extra help. Next slide, please. So the Maryland Insurance Administration is a state agency, and we're responsible for regulating the business of insurance. So what that means, it's that the people that sell insurance and the carriers or the companies that offer these policies, we essentially are here to make sure that they're following state law. We do not sell insurance, and so we don't offer information about specific carriers in that way. However, we have a list of different responsibilities that help to make sure that we are here to educate and protect consumers. And so that includes licensing the individuals that sell insurance policies, reviewing some of the rates to ensure that they are not inadequate, excessive, or unfairly discriminatory. And we investigate consumer and provider complaints. So we're here to be an educational resource to ensure that folks, when they're entering certain insurance policies, can have information to go to that is unbiased. But we're also here as a protection piece, right? So we're here to be somewhere that folks can go to if they have general questions, if they need to file a complaint or report any allegations of fraud. Next slide, please. So as you can imagine, in order to fulfill a lot of these responsibilities, there's many divisions that are within the insurance administration. The one I'm going to focus on today is consumer education and advocacy. And so this is our consumer-facing unit within the administration, and we are responsible for providing consumer education. So we provide a plethora of material on our website, but we're here to provide education on the various insurance types. And this includes all lines of insurance because the administration is here to regulate all lines of insurance, and that includes homeowners, auto, but also your life and your health policies. And this information goes into detail about consumers' rights on these various coverage types. In addition to providing material online, we also participate in events in person. And so we try to meet the community where they are. This could look like resource fairs, libraries, farmers markets, so on and so forth. We provide online presentations and webinars like this. And then one-on-one assistance. So I'm going to talk a little bit about our team that's set up for health coverage questions, but we do have one-on-one assistance for consumers that have questions with their homeowners or auto policies as well, and I'll add that information into the chat. Next slide, please. Alrighty, so our team set up within the Maryland Insurance Administration to help answer those questions about health coverage is called the Health Coverage Assistance Team, or more commonly known as HCAT. And so this team is really set up to work with consumers, listen to the types of issues that they might be experiencing when accessing care through their health coverage, provide information, explain how those different processes work, and help resolve those issues with that consumer. Lots of times what this looks like is working with a consumer that has to then work with another agency or another organization. But what's special about the Health Coverage Assistance Team is that we will stick with you through that process. And so HCAT is really here to be an ally, right? And walk with the individual that's experiencing any barrier or has just general questions about their health coverage that don't rise to the level of a complaint. However, this team is set up to help even if we get to the level where we go through the complaint process and explain what that process looks like. The Health Coverage Assistance Team is here regardless of what your health insurance is or how you get health coverage. Because we recognize that health insurance is incredibly complicated, right? There's so many different factors that go into play. And so this team is set up as a no wrong door approach. And so if you contact us in order to get assistance, but we're not the appropriate entity for you to be at, we'll get you connected to the right place. And we'll stick with you through that process until your questions are answered or your concerns are addressed and we get to some sort of resolution. And then lastly, individuals can reach out to the Health Coverage Assistance Team for inquiries or things that they have issues with themselves. They can reach out on behalf of someone else. And organizations can reach out to the Health Coverage Assistance Team, right? So if you're working with an individual and you want to maintain that relationship, but they have a certain barrier to care and they need some additional assistance, organizations can reach out on behalf of that consumer and just get a little bit more information and education on next steps. And we're happy to provide that. We're also happy to provide trainings and talk more specifically about those policy types that we regulate and some of the consumer protections that individuals have. All right, next slide. All right, this is the second program that I wanted to talk about with the Maryland Insurance Administration. We are here 24/7. We do host a 24/7 hotline for consumers that need emergency care. And so, to paint a picture, if you are in the emergency department or you're in an emergency situation and the insurance company is creating a barrier for you to be able to access those services, the MIA does host a 24/7 hotline, which we will add into the chat as well. In those situations, we are here to assist consumers and providers that are calling on behalf of consumers with those emergency medical necessity appeals. For all other situations, though, things that are non-urgent or you just need general assistance, you can always contact the Health Coverage Assistance Team in those situations. Next slide. And this is how to reach us. So the Health Coverage Assistance Team information is on your left, and you can reach us either by phone or by email. Our phone number is 410-468-2442. And that's manned from 8:30 to 5 each day. And then for those that need that 24/7 hotline number, it's 1-800-492-6116. All right, thank you guys.
Thank you so much, Ruth. And moving right along, we have Liz Villegas from CASA. Liz, I think you're muted. You have to unmute your mic so we can hear you.
I am so sorry.
There we go. Perfect. All right. There you go.
Thank you. Good afternoon, and thank you all for allowing me to introduce you to CASA and its services. Next slide, please. CASA is a nonprofit, community-based, and membership-based organization located in 4 states, has over 140,000 members across the United States. We provide services in your native language, such as Spanish and French. Next slide, please. CASA Service Department is composed of 6, and I'm going to get into it with you. Next slide, please. Let's start out with Health and Human Services. Our multilingual health hotline. Our hotline operators will connect callers to services provided either by CASA or a referral service within the community members, the state they reside in. Next slide, please. We have a medical interpreters program, which provides professional medical interpretation in partnership with several community clinics in Montgomery County to facilitate communications between health providers and patients to ensure quality care. Next slide, please. We also have a team of community resource navigators and social service access team. They will conduct assessments and screening for community members who are interested in enrolling in the public benefits that have already been previously discussed. Next slide, please. We also have a community outreach program. Our community outreach team is composed of CHWs and volunteer teams that will connect community members to services such as food, health, and housing, and bring help to the underserved communities, fostering community spirit, and bridging the gaps for those facing barriers. Next slide, please. Now we're going to talk about our educational and vocational training department. One of our programs is Life Skills ESOL, which aims to assist community members to build their English proficiencies. These classes range from introduction to advanced skills, and they assist our community in building their English proficiency. Next slide, please. Our financial education team has a training that provides individual or group-based financial counseling. We also do tax preparation and even assist in applying for tax identification numbers. Next slide, please. CASA provides with CASA partners, to provide vocational training with community colleges, universities, and others to offer a range of vocational training classes, such as HVAC, blueprint, certified nursing assistant, and much more. Most of these classes are provided in multiple languages, including Spanish, French, and English. Thank you. Next slide, please. Our citizenship department has a comprehensive citizenship initiative that includes citizenship education, mentoring and interview preparation, application assistance, and post-naturalization support. Next slide, please. Our legal department provides a variety of legal services for low-income immigrants who are experiencing problems in housing, employment, or immigration-related issues. Next slide, please. In light of the ongoing crisis involving immigration enforcement, CASA has launched a critical hotline designated to empower community members to report sightings of active immigration and custom enforcement, also known as ICE raids, throughout Maryland, Virginia, Pennsylvania, and Georgia, but are not limited to those, since we have received reports all across the United States. Next slide, please. Our Employment and Welcome Center department, we have 3 locations here in Maryland that connects employer with experts in construction, carpentry, landscaping, and much more. We have reliable workers that are available daily. Next slide, please. This is our Community Organization Department. And what they do is that they conduct widespread regional outreach and organizes its own members into local committees, that develop individual and collective leadership to fight for social justice and human rights. Next slide, please. Thank you for allowing me to introduce you to CASA and all of our services. If you have any questions, please put them in the Q&A. Thank you.
Thank you so much, Liz, for that. And moving right along, we have Suja Joseph from the Department of Labor Professional Outplacement Assistance Center.
Well, good afternoon, everybody. I'm happy to introduce some free programs that we have for the citizens of Maryland if you're a job seeker. I work for the Maryland Department of Labor, the Division of Workforce Development and Adult Learning. And I'm the statewide director for reemployment programs. One of the programs I oversee is the Professional Outplacement Assistance Center. So we were set up about 30 or more years ago, mainly to help job seekers who are in the professional, administrative, executive, technical, managerial. So if you're a mid to senior level, usually you come to us, and you are referred to us usually through people who have attended before or have worked with us before, or through our American Job Centers. And if there's anyone here and you have not heard of our American Job Centers, throughout the state in every county, I would urge you to look up your closest American Job Center. So in the chat here, I'm going to add these links for you. And if you look at the bottom one, the one that says 5, I'm sorry it's skewed, but it says Career One Stop. If you go to Career One Stop, and if you click on Find Local Help, and you put your zip code in there, you should be able to see your closest American Job Center. For us, the office here at the Professional Outplacement Assistance Center is at Linthicum, in Linthicum Heights. But all of the services we provide you can be done virtually. This is a statewide program. So anyone from around the state can request counseling services or any help needed as a job seeker, and we will meet one-on-one with you virtually if you're unable to come into our office. So let me shorten it for now. For the Professional Placement Assistance Center is also called POAC. So at POAC, our staff deal one-on-one with job seekers, and we do workshops as well. So the reason I have, the two Jumpstart sessions listed on there, I will show you a full calendar, is because those are our orientation sessions. We would require you to attend those orientation sessions in order to continue receiving help from us. So next slide, please. Our jobs, the job seekers that we serve, I did mention before, are in the professional, executive, managerial, technical, scientific, administrative, those types of jobs. And this is the only state, Maryland is the only state in the United States that helps with such a program for our job seekers that is free. So you would have to actually pay hundreds of thousands of dollars in order to receive these services from another like outplacement center. Next slide, please. And we also, here are the services that we provide. So when job seekers come to us, the first thing they think of is, oh, I need a resume. Usually that's what we start assisting you with. But we offer help with interviews. So when you send out your resume, you're expecting an interview. We help you prep for interviews. We will go over your resume with you. And we're also at job fairs. So we go there as resume doctors. We'll give you a quick overview of your resume and quick tips to improve your resume if you wish. Also, we meet with a lot of people who wish to switch career fields. Again, your American Job Centers, please remember that you can go in there. Let's say you want to, like the industry you're in is dying. You can go to your American Job Center. They will pay to help you get certifications. If that's something that will help move you into, a new career or a job quickly. So a lot of help and free help available to you through POAC and the American Job Centers. You will come to us then after the interview. Sometimes this is a good problem to have with multiple job offers. And we can also help you with evaluating these job offers and with salary negotiation as well. Again, just naming a few, but if you can think of it and a help that you need as a job seeker, we're here to assist you with it. And if that's a service we don't provide, we're happy to reach out to partners, reach out to people we know, and to help you, get that service as well. The next slide, please. I want to be sure that we shared our monthly calendar with you. This is an example of workshops that we do every month. So you could come to us for resume help, for help with interviewing, any assistance that you need. But these workshops are great. Some are in person. Actually, one going on today, an in-person workshop. On the calendar, do you see the 16th? Do you see in-person agilities with Draw Your Future? That's going on right now, probably just ended. But a nice way to get together to learn, and most people who come in person really enjoy it, the networking and the ability to actually, connect one-on-one in person. So you'll see on the first Monday, we offer our full day orientation session. Okay, so you can attend that one, or you can attend the virtual Jumpstart. So those are our orientation. See on the 11th. So those are our orientation sessions, okay? But we have virtual networking workshops where you learn how to craft an elevator pitch, network with others, LinkedIn and other social media, interviewing. And the Agilities is a skills assessment workshop, okay? You don't even need us. The website is set up in such a way, and it's a free resource for everyone. It's agilities.org, www.agilities.org. If you go on Agilities and take the Agile Work Profiler, take you about 15 minutes, it will tell you what your top agilities are in ranked order. And they have career assessment tools where you plug in your agilities now, and it will tell you, based on your interests and what you're really good at, here are the industries that, are hiring for people with your agilities. So it's actually a really good way to expand your career pathways, ideas that you didn't have before you'll see popping up for you. So we're all certified agilities coaches and able to assist you with that. And job fair strategies. We created that workshop because we're at a lot of workshops. And when we go to, at those job fairs, and when we go to those job fairs, we see opportunities for improvement. Let's put it that way. How can we maximize our presence at a job fair? So we created that workshop, for you. And on the 18th, see, we have the resiliency circle workshop. You just come and attend and tell us what you're facing. What's going on out there? What do you need? What are some trends you're seeing? What would you like to talk about? So just about an hour or so, but ends up being, really helpful and a very interesting workshop. And we also did, and during COVID started this, a stress relief workshop. You'll just get some tips and ideas to, like, just breathe a little bit, not let the stress get to you, because job search can be stressful. So again, just an example, the way to register, and I do need to say that on the right side at the bottom above the hot chocolate, do you see to register email poac@dllr. And that I put in the chat as well. That's the way to reach us. Okay. So email us, send a separate email for every single workshop. Okay, so if you want to attend the interviewing workshop, please let us know in an email, and a registration link, a Google form will be sent to you. And that's the best way to reach us, to register for workshops and also request our services. Okay, this email comes to, we have 4 staff members, comes to all of us. Okay. I'm happy to answer any questions you have. The next slide will give you our contact information, which I already put in the chat. Happy to put that back in again. But if you have any questions, I'm happy to answer them as well. I do want to thank Jenny. Thank you so much, Jenny, for inviting us.
Thank you so much, Suja, for that information. And moving right along, we now have Renee Stainrod from the Department of Aging, Maryland Access Point Program.
Good afternoon, everyone. As previously stated, my name is Renee Stainrod. I am the manager for the Maryland Access Point Program through the Maryland Department of Aging. Next slide, please. So the Maryland Access Point Program is a statewide initiative through the Maryland Department of Aging that connects individuals through essential resources, services, and supports. We really are the one-stop shop for resources for older adults, as well as folks living with disabilities. Next slide, please. We serve, again, older adults, those living with disabilities, as well as caregivers. We provide unbiased, reliable information and counseling to people regardless of their income. We help access public as well as private programs and assess outreach and education, as well as referrals. We have a great partnership with 211 where folks can access our information regardless of the day or time through our MAP link phone number, which is also provided on the screen. MAP really is that one-stop shop for information. It minimizes the frustration folks can feel by being passed to this organization for this number. We really try to encompass all these services and supports in-house. Next slide, please. The core services through MAP include information and assistance, level 1 screen, which is the first point of access for waiver services through the Department of Health. We provide options counseling, which again is that person-centered, holistic options counseling and service supports. We also offer supports for Money Follows a Person, which really keeps folks who are transitioning out of nursing home facilities into their homes so they are able to live within the community of their choice. Next slide, please. some of the services, and I encourage folks to take out their phone, scan the QR codes. You can get direct access to a lot of these resources. Seeing with most recently in the loss of SNAP benefits for so many people, we have supports and services for food access. Folks can call their local MAP office and get connected to available food resources. Next slide. Healthcare coverage, which is super important. Open enrollment just ended, and our MAP office also has a lot of supports and services through our state insurance, health insurance program, also known as SHIP. Folks can call our office and get a lot of resources when it comes to their insurance. Next slide. SHIP provides assistance for people with Medicare, their families, and caregivers, being able to get free, unbiased, and confidential information. Next slide. SHIP provides counseling, application assistance, outreach, and education. I want to say application assistance is so important. We see a lot of missteps in applications getting returned and a lot of frustration from our clients just because of a missed question. Our counselors have a great opportunity to connect with individuals and make sure those applications are complete before submitting. Next slide. So SHIP can help with understanding cost and coverage, comparing plans, enrollment, programs that help with paying for Medicare, as well as prescriptions, troubleshooting billing issues, as well as submitting appeals. Next slide. MAP also assists with equipment and technology. One of the really cool programs that we have is DME, also called Durable Medical Equipment, which offers free medical equipment to Marylanders, whether it's a wheelchair, whether it's canes, whether it is bathroom seatings. We offer these items for free of cost for individuals, and all you have to do is go to our DME website. You can scan the QR code and it will take you right there. Next slide, please. Abuse and exploitation. Again, open enrollment. I feel like a lot of individuals, seniors are experiencing, fraud and abuse. Our ombudsman program supports and advocates for health, safety, and well-being and rights of individuals in assisted living and nursing homes, as well as different resources for financial exploitations for older adults. Next slide, please. We have 23 local MAP offices throughout the state of Maryland. I certainly encourage you to connect with your local MAP office for continued resources, or you can connect with me directly. Next slide. My information is on the screen. You can follow me or follow the Maryland Department of Aging on all platforms of social media. And I encourage folks to figure out or find out more about Maryland's 10-year plan for the Department of Aging by looking into the Longevity Ready Maryland plan through the Maryland Department of Aging. And the QR code and link is on the screen to find out what is the plan that the Maryland Department of Aging has for older adults. Thank you so much for allowing me to participate today. I will be here for additional questions.
Thank you so much, Renee. That was a really helpful presentation. And now just moving right along, last but not least, we have Chris Speedy from the Maryland Food Bank.
Hi, thank you, Zoran. Hello, everybody. Next slide, please. So I'll introduce myself. My name is Chris Speedy, and I am, excuse me, the Director of Neighbor Engagement at the Maryland Food Bank. And the Maryland Food Bank is a nonprofit organization dedicated to addressing hunger in the state of Maryland. We operate by collecting food through donations, retail recovery, and purchases, and then moving that food through our warehouses out to our community partners. We have three warehouse locations, one just outside of Baltimore, one in Hagerstown, and one down on the shore in Salisbury. Now, the food bank has about 800 community partners that distribute food, And these include food pantries, emergency shelters, feeding centers, schools, community centers, and senior residences that know their communities and ensure that nutritious food gets to neighbors that need access. And Jenny, so you have the slide up? Great, thank you. And just one more slide, please. Appreciate it. Thank you. So you can find our partners at our Find Food website listed here, www.mdfoodbank.org/findfood. It provides each partner's location, hours of operation, and contact information. We operate in all counties in Maryland except for Prince George's and Montgomery County, which are covered by the Capital Area Food Bank, and we have their Find Food tool listed here as well. And then if you're looking for food outside of the food bank networks, I highly recommend checking out 211, which is mentioned earlier, either by dialing 211 or utilizing their website. They have a number of excellent resources on that website. So again, highly recommended. And then for Baltimore City specifically, you can find food resources at charmcare.org. Next slide. So our pantries are open to all, regardless of income, citizenship status, language, or family size. ID is never required except for certain government programs, and reasonable accommodations are always available. I do recommend calling ahead prior to visiting a pantry to get details on the food distribution and to figure out where to go, when to show up, etc. Next slide. In addition to food distribution, the Maryland Food Bank has a number of programs aimed at different segments of the population. Our partner programs are designed to build capacity among distribution sites so that they can have greater impact in their community. Our programs for children focus on school meals and providing nutritious food to growing minds. And our neighbor-facing programs help address the root causes of food insecurity so that people have the tools to address needs beyond food. These programs include our mobile market, which brings food to rural communities lacking a traditional pantry, and our FoodWorks culinary training program, which provides people with the skills to find a job in the food service industry. I work for the SNAP outreach team, which connects individuals with government benefits and community resources. Next slide. So almost every weekday, our SNAP outreach team travels to strategically selected community centers, faith-based organizations, and residential housing facilities to promote SNAP and help eligible Marylanders sign up for government benefits and other resources. We are also authorized by the state's Department of Human Services to act as a liaison in the SNAP application process, and we arrive on site with the needed resources to simplify the application process of eligible Marylanders from start to finish and send applications directly to government offices. You can reach us at our toll-free number, which is listed here, or by email at snapteam@mdfoodbank.org. Next slide, please. At the food bank, we strongly believe in SNAP because it is the nation's most effective hunger fighting program, providing the equivalent of 9 meals for every 1 meal offered by the Charitable Food Network. By helping families enroll in SNAP, we can stretch household food budgets and reduce the need for emergency food over time. Additionally, for every dollar spent on SNAP, it generates an additional $1.79 in local economic activity. And there are currently about 680,000 Marylanders accessing SNAP benefits to help make ends meet. However, we know that many eligible Marylanders forgo food assistance from SNAP due to a lack of awareness about their eligibility or difficulty with the application process or perceived social stigma. So that's where we step in and try to bridge the gap between the barriers to access and receiving benefits. Next slide. In addition to SNAP, we can help people enroll in a number of other benefits, including energy and water assistance, temporary cash assistance, and Medicaid for the aged, blind, and disabled. We also provide referrals for a number of community resources, including WIC, housing, legal assistance, and childcare. We try to operate as an open door for wraparound services as we want to address any need a neighbor may come to us with. Next slide. So if anyone is interested in having our neighbor engagement and SNAP team come out to speak with your community, you can reach out to us either at the SNAP team at mdfoodbank.org email address or at the link at the bottom of the slide here. We do ask for a few weeks notice before your event or whenever you'd like to schedule us, but we're happy to go anywhere in the state besides Montgomery and Prince George's County in order to talk to people about their benefits and resources. Next slide. I'd also like to quickly highlight just a couple of other programs that help people extend their SNAP benefits. So first is the Maryland Market Money Program. If you just click enter one more time, thank you. So the Maryland Market Money Program provides a dollar-for-dollar match for purchases by EBT card customers at participating Maryland farmers markets. This is a great program, open to anybody who's receiving SNAP, WIC, or FMNP dollars. And all you have to do is find the Maryland Market tent at a participating farmers market, and they can set you up with the program. You can find farmers markets at marylandmarketmoney.org. And next slide, please. Also like to highlight the SHARE program. This is a discounted grocery program run by Catholic Charities. It's about a 50% discount on groceries and includes fresh meat, fish, and produce, which can sometimes be difficult to find. You can use your SNAP money to buy these groceries, and it's available in large parts of central Maryland, some a little further out state as well. You order the food, the groceries, you pick them up at a partner site located at the Shared Food Work Net site, and you can pick up these groceries, again, half price, about once a month. And then next slide, please. And then I'd just like to, again, highlight our job training programs available at the Maryland Food Bank. So we do have the FoodWorks Culinary Job Training Program, 12-week in-kitchen intensive program. You end up with a certification graduation. And then we also have a community navigator program. So anybody interested in learning the skills that my team uses on a daily basis, helping people navigate government benefits and community resources, you can send us an email, and we'd be happy to introduce you to the program. And last slide. Again, our contact information is here, both our toll-free number and our email. Thank you very much, everybody.
Thank you so much to all of our speakers that we had today, and I'd like to turn it over to Jenny for our Q&A section.
Thank you, Zaran, and thank you to all of our speakers. We do have a number of questions that have come in. I see some of them have been answered, but I'm going to jump back up to the top. The first question, let's see, can you please provide details on the Maryland Caregiver Support Program, especially education, training, and resources? Is there a respite program through social services in Prince George County? Not aging, is that under the program? I wonder if our colleagues from aging would like to address this question. Resources for caregivers, Maryland Caregiver Support Program.
Yes, so the Maryland Department of Aging is really reassessing how we look at caregivers. We are certainly putting more of a focus on how folks see themselves as caregivers and providing resources for specifically for caregivers that include a lot of respite support, and making sure that folks have access to waiver services that support caregivers. Caregivers are doing a lot of work to support their family members, and a lot of them through different waiver services can be compensated for the work that they do for their loved ones. So we have an entire page dedicated to caregivers. We also have the caregiver checklist through Johns Hopkins that we are piloting and right now that provides different supports and resources specifically to caregivers. So I absolutely would support folks going on to the Maryland Department of Aging website, to the Maryland Access Point website, and reaching out to or accessing our caregiver specific page and learning all the information that is there.
Thank you, Renee. The next question comes from Marilyn Jones. She says, can you explain Medicaid QMB? I have a client who is Medicare Advantage plan, did not qualify for Medicaid, but was eligible for QMB.
Sure, I can take that. So QMB stands for Qualified Medicare Beneficiary. In this case, an individual doesn't have full Medicaid coverage or like full Medicaid benefits, but it means that an individual is entitled to having certain things paid for by Medicaid, and that would include their Medicare copays, coinsurance deductibles, and then their monthly Part B premiums. So it doesn't cover absolutely everything, but Medicaid does step in for some of it. And they're still considered a dually eligible individual.
Okay. Thank you, Meredith. And then Kashan says, I have Medicaid coverage, but I have not been entitled to have an MCO. Why is that? And is there anything I should do to have one?
That likely depends on how you became eligible for Medicaid. So if somebody is enrolled based on income alone, they're typically going to fall into that MAGI, modified adjusted gross income population. That individual would have a managed care organization automatically based off their coverage. If somebody qualified because they're aged, blind, disabled, enrolled in one of our other programs, which does take into account income, but there's all these other criteria that must be met, they would not have their care managed by an MCO. So just it's likely just dependent on what coverage you qualified for, and that would be why you wouldn't have one.
Thank you, Meredith. The next question is from Tatiana. She said, my senior parent lost Medicaid because she had her permanent resident status less than 5 years. She's disabled with multiple medical conditions and had Medicaid for the last year, but now she's not eligible. Is there a recommendation on coverage for this person?
I would recommend reaching out or contacting the Maryland Health Connection directly. I can't speak to somebody's individual case, and it really depends on an individual case and an individual level.
And I'll just add my email in chat. So Tatiana, if you wanted to reach out to me, I can give you some more information about helping your mom enroll in a Maryland Health Connection plan. The next question, I believe, is directed for housing. Roberta says, are these services available to non-citizens as well?
Some are. Most of our supportive services are housing counseling, foreclosure prevention, office of tenant landlords. All of those services are for everyone.
Okay, great. Thank you. Let's see, does Maryland still have rental assistance, eviction prevention, and/or senior housing available? Jeff asks.
Yes, I responded to him and gave him the
Okay.
link. So yeah.
Thank you. Perfect. Charlene says, can a disabled medically needy individual, non-GIF, enrolled in a waiver program be discontinued from the program and Medicaid if the combined household income exceeds the maximum? If yes, why? As their medical needs and disability and are not income-based, meaning their needs and disability exist regardless of household income. I'm going to add, do you want to take that, Meredith?
I was just going to recommend reaching out to DHS and MD benefits for that one. Again, it's super specific to somebody's individual case. So no one would be able to just know off the top of their head at this point.
Would you mind adding that contact link in chat again?
Sure.
Thank you. Okay, let's see. My mom, let's see. Are there programs for dental coverage of Medicare enrolled seniors in Maryland? I'm going to turn this over to Renee. Do you know of any dental programs for seniors?
I think that it would depend on which county you're in. The Maryland School of Dentistry in Baltimore, they have different programs for folks needing dental services that are reduced or free or at cost. but that's in Baltimore. If you are in a surrounding county, I would absolutely reach out to your local MAP office because they're going to have the more local information of different dental services that you may be able to get connected to.
Thank you. A few questions for Liz. Marilyn would like your contact information if you want to send her a chat. And they also would like to know, Paresh would like to know if CASA has a website that you could add into chat. And additionally, does CASA have plans to establish programming in rural communities like Cecil or Harford counties?
So thank you for the questions. I will put everything in the chat. And we do not have at this time, but our offices or the hotline number you can call, we do provide services in that area. We do have a connection with Howard County. And what was the other county? Cecil, is that what you said? So with Howard Public Health, we have a connection there, and we also have one with Cecil. With most of the counties within the state of Maryland, we do have a connection.
Thank you.
Of course. Thank you.
Can we provide any Montgomery County rental assistance phone numbers?
Yes, I put that in the chat.
Okay,
The link,
thank
yes,
you.
well.
And I believe these questions are for labor. Is there support for office space for small businesses? I think Suja dropped off, but if you want to send me a chat about the Montgomery County rental program for office space, I can. Oh, Suja's here.
I don't know that we work with that, Jenny, so I don't know the answer to that
Okay.
question.
Okay, no problem.
I just want to jump in. I'll put the link to DHCD. We do have some programs that might assist that, and I would ask the attendee to check because we do provide some business supports for small businesses. So I'll put that link in and for the person asking.
Thank you, Lyrica. I appreciate that. Keith asked, does SHIP have an income guideline?
I think I answered that question. SHIP does not have an income guideline. Anyone is able to work with SHIP if they're interested in figuring out what's going on with their individual Medicare plans, if they're looking for different supports, how to apply changes to their account information. If they're looking to appeal, if they're looking to figure out, well, what's going on with my bills, SHIP is open to all Marylanders who have questions about their Medicare.
Okay, great. And jumping back up to a Medicaid question, Pig Wendy says, my mom lives with me and just got her citizenship last year, but lost her Medicaid. The monthly payments went up to $900. And Pig Wendy, you're welcome to send me an email. We can get you some resources from the Maryland Health Connection and the Medicaid for her insurance. So question here from Kashan, all Medicaid holders are all Medicaid holders over the age 65 also entitled for Medicare coverage?
That depends in most cases. Yes, however, there are certain eligibility factors to be eligible for Medicare. I would recommend talking to Marilyn Shipp, who presented here today, and they can probably best direct you.
Okay, great. Thank you. Okay, let's see here. We're definitely going to be we'll be emailing you all the slides, so you'll have all of the content that was presented in your inbox. I see Liz added her coverage here. Tatiana says, I need help to cover adult daycare services for my mom that was previously covered by Medicaid. Now we lost access to the daycare. Adult daycare. Does anybody have anything to suggest for that question?
If they need help navigating some of those systems, they're more than welcome to contact the Health Coverage Assistance Team and we'll walk them through that process. Although the Maryland Insurance Administration wouldn't be the entity that like controls all of that, we'll work with them to contact the appropriate entities and help them navigate those.
Okay, thanks, Ruth.
And the contact information for HCAT should be in the chat, but I'm happy to add it back in so that it comes up towards the end as well.
Okay, great. Adiola asks, are all Medicaid accepting providers required to offer interpretation by law?
I would need to take that back. I'm not sure.
Okay. Thank you very much. And then Ben says he is a graduate student and lost SNAP eligibility. They are food insecure and the heat pump died. Oh no, I'm so sorry.
I can definitely step in for this one for Maryland DHS. We do have our SNAP program, and it is one of our least strict programs. So if you were not eligible once before for SNAP, I would highly recommend to reapply as eligibility changes for all. Now, as far as the heat pump, we do have our OHEP, which is the Office of Home and Energy Program. So if you're facing any type of hardships with utility bills, I highly recommend to fill out our OHEP application, which is separate from the SNAP application. We also now have application processing. So if there is anyone in need of having assistance completing those forms, you can call our call center and they'll be able to fill out the application on your behalf to get the process going.
Awesome. I will also add, if you are a student receiving a stipend, stipends do not count as income. So I would absolutely connect with your local social service office and get some assistance in filling out that application for that SNAP benefit application, because if you're only receiving a stipend, technically you're receiving zero income.
Thank you for that, Renee. I know we didn't get to all the questions, but we are at time for today's webinar. So I hope that you were able to take away some helpful resources and information, and a big thank you to all of our colleagues here on the call who were able to share their expertise with us today, and to my colleague Zaran for helping us kick this off. Hopefully we can come together again in the future and share more resources for Marylanders. And I wish you all a very happy and healthy holiday season with your loved ones.
Thank
Thank
you
you.
so much.
Thank you.